the last presentation for the launch, and it gives me great pleasure to be here with you all to share about our screening programs and your role as primary care physician in helping more people to come for screening. In my outline, I'll be sharing with you all about three key things: the current health challenges that we face in Singapore today. I will also mention briefly about the existing screening programs that we have in place, as well as what are the insights to the motivators as well as the barriers that people have about screening. And lastly, but most importantly to us, is the role that you can play in helping us to get more of your patients to come for screening. Based on an affluent lifestyle that we face in Singapore, a lot of Singaporeans today now have a very hectic lifestyle, and this is also coupled with very poor diet. So sometimes we always, when we work late at night, we rush to the fast foods because it's easier. And all these lifestyle practices has actually led to a rise in obesity rates in Singapore. In addition, Singapore is also faced with a growing population, and we know that 1 in 5 Singaporeans will actually turn 60 years and older by the year 2030. So as we have seen in the previous presentations by our experts here, the top cancers in women are first breast cancer, where the lifetime risk is about 1 in 16 women getting breast cancer. This is followed closely by colorectal cancer, and in line number 6 will be cervical cancer. When we look at the men, colorectal cancer is the topmost cancer in Singapore, and we have seen the age standardized rates doubling in the last 3 decades, with 7,000 new cases being reported in the period of 2003 to 2007. So what should we do about this? So based on the current CPGs that you have with you now, these are the recommended screening tests that you should be asking your patients, and we have put down on the table the frequency and the recommended age to start to encourage your patients to go for screening. So under HPB, we have actually rolled out 2 cancer screening programs on a population-based level. The first is the Breast Screen Singapore program that was first introduced in year 2002, and the main target is to reach out to women who are 50 years and older. And screening is currently made available at all the X-ray centers in the polyclinics, as well as GPs can also come forward to refer their patients for screening. The second program that was rolled out 2 years later was a cervical screen program, and we are looking at women who are 25 years and older. When we first started this program, we introduced this in the polyclinics, so in all 18 polyclinics in Singapore. But recently in 2008, under the integrated screening program, we have since introduced pap smears as well in the GP clinics. And very excitingly, we will be having the introduction of the colorectal screening program later this year, which Prof. Yeo has already mentioned. And this will be looking into inviting Singaporeans who are 50 years and older to come for screening. So with all these plans in place, whereby Ministry as well as Health Promotion Board has introduced these programs, has Singaporeans been coming forward for screening? So a couple of studies that I'll be sharing with you later actually show that there are still some barriers towards screening. And we know that based on the hectic lifestyle that we have, a lot of Singaporeans have to juggle both career as well as the family demands, be it looking after young children or even elderly parents. And because of all these things that is all trying to compete for our attention, a lot of times health does not come up as a top priority in our life. And many times we also feel that because we feel healthy, therefore it is not really necessary to take care of our health or even go for a health screening. So what can we do about this? Based on the previous NHS as well as the NHSS surveys that were carried out previously, here are the awareness levels as well as the practice levels of mammogram, pap smear and FOBT. We have seen over the years that mammogram and pap smear awareness levels have increased over the years, and this is something that we are very happy about. Unfortunately, the practice levels are still lagging behind, and there is still much improvements that we can do to narrow this gap. Similarly, for FOBT, we have seen the knowledge as well as the practice levels still very low. In focus group discussions that we conducted in 2006, whereby we wanted to actually measure and find out whether women will actually come forward for not just the first screen but for subsequent mammograms, these were some of the key reasons that were cited. And of the top 3, we noticed that about 40% of the women actually said that they would go for a subsequent mammogram because it is part of the routine of my checkup, as well as because the doctor recommended the test to me. And we also saw that again in as advised by the doctors. So what does this all tell us? The thing that I would like to share with you all here is that your role as a primary care physician is very vital to the program. Okay, as in the earlier presentations you saw, having all these screening programs in place is very good. But what's the point if people are not coming forward and there's no high adoption rate for screening? So this is where we would like to strongly encourage all of you to come and join us, and we would like to strengthen that partnership because we feel that your recommendation as a doctor is very important in trying to encourage your patients and to motivate your patients. Okay, and the second thing is that you'll be able to help us to actually explain to your patients and regarding their fears and inhibitions that they might have about screening. Okay, so we also did some interviews with doctors as well as patients just to find out a little bit about what would encourage them to go for screening. So one of the doctors, a GP, actually said that patients actually just need a little nudge sometimes. You just need to poke them a little bit and remind them that, hey, you are already 50 years. I don't think you have gone for a mammogram recently. Maybe I should actually ask you to do so. Okay, and then similarly for the patients, they said that again the fatalistic viewpoints came up very strongly, okay, whereby they felt that there was no need to go for screening. Now, why should I go? Because I actually feel fine, so I don't think there's anything wrong with me. But in actual fact, this lady actually said that if my doctor hadn't advised me to go for the screening, I wouldn't have known what was actually wrong within me. Okay, and in fact, I might have actually collapsed one day. So for you all who have actually heard about our programs, breast screen, cervical screen programs, and you might be asking inside yourself, how can I now go about actually, approaching the subject about screening to my patients? Here are some of the support that HPB is rendering to you all. First of all, we have a series of health promotion resources that are available for you all. Okay, and you can easily actually get them either online, you can view our publications online, or you can actually go to our health information center to ask. And the second thing is, if you would like to find out more about our screening programs, please feel free to visit our Health Promotion Board website, where we actually detail down the program, what are the eligibility criteria, as well as the workflow. So you can actually find out more about our programs and see how you can actually be part of this program. Okay, and to end off my presentation, I would just like to encourage all doctors out here to join us in the fight against cancer so that we can actually reduce the incidence and mortality rates of cancers, and also to share in our vision of building a nation of healthy as well as happy Singaporeans. Thank you.